All right, this is part 2 of medications that can increase the risk for suicidal ideation and suicidality. The risk is relatively rare with these medications, but nonetheless it's important to know. So first on my part 2 list is isotretinoin. It goes by Clarivis or Accutane. It's an oral retinoid for severe acne. It is contraindicated with pregnancy. I feel like most people know that. But it has the side effect also in some patients of aggression, depression, and anxiety. Second on my list are Z drugs and benzos. So Z drugs being like Lunesta and Ambien. They can cause complex sleep behaviors, which is something important to know as well, like somnambulism, like sleepwalking, and like sleep eating, sleep driving, some dangerous activities like that. And then the benzos, of course, like Xanax, Valium, lorazepam, medications like that. These medications also can worsen depression, cause some memory impairment in some people, and then, of course, cause suicidal ideation in some people, so it's important to know. But the memory impairment that I previously talked about is with long-term continued usage, especially with benzos. So another medication is topiramate or Topamax. Most patients, I would say, use this for like migraine prophylaxis or migraine prevention. Some people use it for weight loss. It's in a drug called Qsymia mixed with phentermine. Let's see. Some people use it for seizures, but I would say most people use it for the prior indications that I mentioned. But it also has a side effect of mood or behavioral changes. Another drug class is fluoroquinolones, like the ciprofloxacin, moxifloxacin, levofloxacin, medications like that. They can also cause seizures too via GABA A receptor blockade. And the mood changes with this is like extremely rare. But it can also cause depression, sleep problems, confusion, and hostility sometimes. It's important to know though, but most patients are on it for like an acute course of treatment if they need it or if they have some drug resistance organisms that are growing. Another medication is mefloquine. It's an older drug. We used to use it more often for like malaria. We don't use it too often because of its both psychiatric side effect profile and then increased risk for heart problems. So we usually use something like atovaquone proguanil or even doxycycline before and after you come back from a trip in malaria-prone areas. And then the last thing I'm going to mention is any really hormonal medication like oral contraceptives, progesterone. Some patients report like changes in mood, behavior, anger, depression, sort of that kind of side effect. So I thought I'd at least mention it in here.